Did you know that South Asians are at such high risk for major diseases and illnesses that a movement for health awareness education and access to resources has now become a fundamental stand for several South Asian health outlets across the board? Research indicates health factors covering areas from heart diseases, diabetes, women's health, mental health, and much more. I'm Aditi Lamba with ITV Gold, and tonight we begin another edition of our push towards South Asian health awareness and well-being by bringing to you a series of healthcare professionals and institutes on ITV Gold. We've noticed that a lack of knowledge and understanding of preventive medicine and care has now become a great common factor for many South Asian health issues here. So now we are opening up our platform. Welcome to Desis in Health with Dr. Soma Mandal, a passionate doctor, advocate for long-term success, and a pioneer of internal medicine here in Tri-State. Proud of our cultural heritage, we look forward to many great conversations. Let's welcome on the show, Dr. Soma. Thank you for being here.
Thank you, Aditi.
It's so great to have you here with us today on ITV Gold. Such an amazing platform to have amongst us. Dr. Soma, you've had such an amazing journey and years dedicated to medicine. What has brought that interest? And also today when we're beginning the show for all our audiences, what has brought you here?
So I have been wanting to be a physician since I was 5 years old.
Wow.
And it was something that was deep within me. I saw many health issues within our community as well as in my family, and that inspired me to want to become a doctor. And to this day, I continue to see these issues, and I try to help as many patients within the South Asian community to combat these issues, to be healthier, and to be happier.
For our audiences, what do you hope they can learn from you, from this series?
I hope that they can learn from the messages that I'm bringing to them, that they realize that there are resources of help for them, that they don't need to be ashamed and scared, that we are here to help them.
Definitely. So, everyone, stay with us. We have a very first interesting topic for our first episode with Dr. Soma Mandal. So let's take a look. And welcome back to Desis in Health with Dr. Soma Mandal. Going right into the episode, I'm so excited to kick off this entire show with an amazing topic, and the topic is infertility. It's definitely a topic that we consider taboo in South Asian population, doctor, and it's a topic that impacts women of all kinds from all communities. So just kicking off this interview with you, doctor, infertility as a subject, how much impact do you think it has on women in general? And also when looking at the South Asian population, what do you think is the impact of infertility on couples and women?
So infertility has an impact on both men and women.
Yeah.
But unfortunately, I think that women take it upon themselves more, that it's somehow their fault. I see this more in the South Asian population, where women feel that they've done something wrong to deserve this, that it's their fault, childless women are often, at risk for blame, that they're not able to get pregnant on their own.
The reason we're discussing, everyone, this topic is the fact that a huge portion of South Asian population relies on its culture, on the theme of family, which is very important to us. And I'm sure, Dr. Soma, you would agree with us on this. And the reason we're discussing infertility, it's a subject because a lot of people do not discuss it. And we really do think a lot of women cannot find a lot of help due to lack of resources, a lack of knowledge, and perhaps a lack of understanding for what they really need. Dr. Soma, what's your comment on this? And what's your comment on the fact that we need to raise more health awareness and make people understand exactly what is happening and how this really impacts the everyday living of so many South Asian families?
Sure. I think we all know someone who was not able to have kids. And unfortunately, at least, in my circumstance, I know people within my community, within society, where the woman was blamed. Culturally, that happens more too often within the South Asian community.
Yeah.
So that was one of the things that inspired me to become not only a physician, but someone who has an expertise in women's health.
Yeah.
And I specifically guide women all across the board, but I also have a lot of patients from South Asia who come to see me for these sorts of issues.
And when we're talking about the issue, doctor, and before I even ask you what causes it, the impact of women's health in South Asian women and its importance. What's your comment on that as a physician, as someone who has such a passion for really raising that health awareness?
So women are often not ones to, South Asian women I should say, are not ones to necessarily come and seek help directly. Often I have to ask them the question directly. If I have a married woman who does not have kids, I ask them, are you planning on having children? And that's when sometimes the issues come out,
right,
where they would not necessarily have told me.
Do you think South Asian women are taking care of their health? Or women in general? I love asking this question because, I see so many South Asian women right now. Personal experience, everyone. A lot of them struggle with a lot of issues, from health issues, from heart diseases to diabetes to other, health-related issues. And women's health is something that a lot of our moms didn't even talk to us about. I would love for you to comment on that.
So in general, women in general, and more so South Asian women, we are the caretakers. We take care of everyone else, and often we come last. We take care of our parents, we take care of our siblings, we take care of our spouses, and our issues are often, either ignored, or we ignore them ourselves.
Right.
And I strongly believe that we should, as physicians, as healthcare workers, try to help women realize that it is important to take their health seriously because they are the center of it all.
That is so true. That is so well said. Bringing it back to the topic of infertility, because I would love for us to get started on it as well. When you see these couples, and we're already talking about a lack of education perhaps among South Asian women, or just the fact that they're so busy taking care of so many things that they don't take care of themselves, when do you kind of see a lot of the cases arise in infertility? And is there an age bracket perhaps of women that you're seeing and men that you're seeing that are dealing with these issues? When is it coming up?
In the South Asian community, I think we still tend to get married relatively earlier.
Yes.
That being said, women are, increasing their education. They are, there are more professionals out there, and so they're prolonging childbirth for that reason. But in general, we are still getting married earlier, and I still think we're having families relatively earlier.
Right.
So the issues are usually seen around the 6-month mark. The true definition of clinical infertility is not being able to conceive after having unprotected sex for 1 year or more.
So these are the couples that are trying, and you usually end up seeing them when they're about 6 months in or a bit more. That's when they decide to seek the doctor.
That's right.
Would you recommend a lot of them to seek the help of a doctor way prior to, instead of waiting all the way?
I strongly advocate for that. There are conditions like PCOS, polycystic ovarian syndrome, that are seen more in South Asian women. And these are things that they're not curable, but they are treatable. And so if we treat these things, we can therefore increase the chance of having a successful pregnancy.
Before we go into the treatments even, doctor, one question to you while we're discussing this. What is the true cause of infertility, if I was to ask you? And, it is a topic at times that when we talk about South Asian women, especially, they truly just get blamed straight away for that. I think it's going to be a huge part of this discussion on this episode. What's your take on it, and what do you think is the cause?
There are many different reasons for infertility. I like to break it out, and sometimes I even use diagrams at work to show them, I draw a picture of a uterus, I draw a picture of a fallopian tube, and then I make potential marks, like you could have a blockage in your fallopian tube. You could not be ovulating, so your ovaries may not be releasing a healthy egg. You may have issues within the lining of the uterus, which may make it harder for a fertilized egg to attach to the uterus itself. You may have structural issues like fibroids that may make it harder for you to get pregnant in general. So there are some real structural issues that women can have, and I didn't go into male infertility yet, but the truth is that 30% of cases where men and women are not able to get pregnant is largely unknown.
It's largely unknown. So they have no idea why this is happening.
Right.
So there is no way you can blame the woman or the man in that case, in the scenario.
There should be no blame.
Agreed.
This is something that we help people with, but really, whether it's for the man or the woman, nobody should get blamed for not having difficulty or not being able to have a child.
So when we are talking about these cases, especially let's address the 30% of cases that don't get known, that have no causes at all, how do you then sort of combat that? And what are some of the areas you target to help these couples?
So I don't have exact statistics as to the success rates, but I can tell you that I do have lots of patients who we don't know why they can't get pregnant, but they're able to. But that's when I get a fertility specialist on board right away so that they can, maybe have IUI or IVF, in vitro fertilization. So if they can't get pregnant on their own, there's still ways of getting pregnant, but you have to utilize other resources.
Well, thank you, doctor. A lot more coming on Desis in Health with Dr. Soma Mandal. Don't go anywhere. Stay tuned. We'll be right back. And welcome back to Desis in Health with Dr. Soma Mandal, and I'm your host, Aditi Lamba. Doctor, right before the break, we were talking about various aspects of what happens when someone is infertile, what are, the causes, and for everyone, a surprising fact, we really do not know a lot of the causes for infertility. So before you blame someone and you add that extra stress, think twice. I'm pretty sure Dr. Soma would agree with us. Doctor, I have to go a little bit into a topic that we were trying to address right before the break. We discussed a lot on women's health and the issues of women and infertility. I would like for you to give us a few comments on the issues of infertility in men as well, because that is definitely a huge aspect of this issue. Wouldn't you say that?
It certainly is. And to be honest with you, more women confide in me that it's their partner who has the issue. Often that the man is not there to let me know about it. So within my practice, I see things like low sperm count. You can have issues with structural issues where the sperm itself are not shaped regularly, and so that with that, if you can imagine, they don't move as well.
Right.
And then there are other structural issues that men can have. Right. They can have blocked ducts. They can have kind of like what we call varicoceles that are like varicose veins that make it difficult for the sperm to get to where it needs to.
Oh, wow. So there's quite a few things that could actually happen. And at the same time, again, you may not even know what really happened.
That's right.
So when you target cases like this, doctor, I have to ask you, in which it could be either or, it could be the man or the woman or both, what are some of the procedures then you go ahead with? And for anyone that is watching the show right now, the procedures that they should know will happen once they find out they're infertile. I would love for you to give us some information on that.
So if you can imagine, I have a man and a woman in my office.
Yes.
The first thing I do is we try to have a very honest conversation where I try to take away, because I could tell if they're blaming themselves or they're, really feeling stressed out by this.
Yes.
So that's the first step, really, is having an honest conversation, building that trust within them. Then I say, what have you done in terms of how long have you tried for? Whom have you seen about this in the past? Have you seen a gynecologist for this? Usually the answer is no, which is still surprising to me.
Oh, wow.
But usually the answer is no. So what we usually do as the first step after that, or the second step I should say, is we talk about all the different tests that we should start with. And usually that means for the woman to have a whole cascade of blood work done to see how her ovaries are functioning, to see if she has the what we call the ovarian reserve, the right amount of reserve to be able to have a healthy child. So this testing usually starts off with women, but with that, I also advise that the men get tested, not lose time, hit it from all angles.
Right.
Then after that round, when the labs come back, I usually have the couple come back and then we sit down and talk. Oftentimes, if, for example, if a woman is of advanced maternal age, then I can say, well, based on your labs and your age, your likelihood of conceiving on your own is lower, and this is the reason why. With that, I usually refer them to a reproductive endocrinologist right away, skipping the gynecologist. Another example is where the labs come back completely normal. And that's when I say, okay, your labs are normal, you have good ovarian reserve, but this could be a structural issue. You could have a blocked duct somewhere, and that goes for the man or the woman. So I usually refer to a gynecologist for the woman, and with that, I refer the man for sperm testing as well. The gynecologist would then, if the labs have not been done, let's say by myself, then the gynecologist would do further testing, which would include an ultrasound to look at the structure of the uterus, to look at the structure of the fallopian tubes. And then there are other tests that are deeper than that, where you can actually look and see if the fallopian tubes are open.
And how often do you have to go at times into the intricate tests, which means you're continuously still trying to figure out what is going on?
We have to do it pretty often.
Oh, wow.
I may not be doing it myself directly, but I certainly know that my patient is having these tests done by other specialists that I've referred to.
So when people are struggling with it, they could be struggling it with pretty bad.
Right.
Wow. So when you go through that whole process of tests, that is just part A of the process, correct? That's just
correct.
Determining, still diagnosis.
Right.
What happens after that, doctor?
So I have them come back. We then, continue to have that conversation. I like to call it a team. Like, we are a team of people. Where I work at Summit Medical Group, we have gynecologists, we have endocrinologists, and I, bring them aboard. And so they become part of that team where they can then take on the next step for the patient, and then, take over the ultrasound testing to see if there's any further structural issues that they can help with.
And then after that is when the treatments would kick in, I'm assuming, correct?
Right.
So what are some of the treatments that are available for issues of infertility? There are certain things that even now, a lot of South Asian bloggers even are talking about in vitro, and a lot more where young South Asian influencers are discussing very openly about it. I would love for you to give our viewers as much information as they can get into the treatments that are available.
Sure. So it depends on what the cause of the infertility is. And yes, we did talk about that. A large percentage of people, it's unknown. That being said, we do see things like uterine fibroids, blocked fallopian ducts, blocked ejaculatory ducts. These things can have a surgical repair to them, and therefore people may not need anything further.
Right.
With that, some people then need to proceed to IUI, intrauterine insemination, and IVF, in vitro fertilization. So when a patient sits down with me or their GYN, and they say, we've tried everything and we have to proceed to that. What do you think?
And that's after the test, doctor, right?
That's after all
of the tests that they have done.
And we've ruled out everything that can be ruled out, and we realize, okay, the couple's chance of getting pregnant on their own is slim. So that's when IUI and IVF come on board. I refer to great specialists where I practice in New Jersey, specialists that have, helped other patients of mine. I also educate the patient about what IUI is and what IVF is if they don't know, because it could be a very scary process. It can be a very expensive process, and it can also be a very stressful process.
Doctor, I would really love for you to give our audiences an insight into exactly, or maybe parts of what exactly happens in the treatment, and what exactly is this process, and also addressing for all our audiences the need for that education and the connection, with your patients. We've often read that this process could be very mentally exhausting, and you just mentioned that. A little insight into that from you.
So if I have a couple where the infertility has been delegated to or found out to be within the man. Let's say he has a low sperm count or abnormal sperm in some type of way.
Right.
That's when I'm more likely to say, let's try IUI. And the reasons for that is it is less costly than IVF, and it is more successful for men who have abnormal sperm issues. If a man has a normal sperm count or normal sperm, and the women are otherwise healthy, and there's no cause of infertility that are found, IUI is not often the most effective treatment. That's when I say go to IVF instead.
So detailing a little bit more into this, doctor, for all our viewers here, IVF and IUE and also other aspects of the treatment, if you could just give us a little insight into what happens during that time, and what are some of the success rates you've seen, or perhaps the success stories that you see in through those kind of treatments?
I see more success with IUI for male infertility. That's where semen is artificially inseminated into the uterus. But for other cases of infertility, IVF is more effective. That's when they take a sperm and egg and create an embryo within a petri dish, and they transfer that to the woman's embryo.
Wow, this cannot be easy on that woman, right, doctor?
It is stressful for both the man and the woman.
For couples that are currently going through this process, infertility and then testings and then going through these treatments, I know we were discussing that there are a certain amount of resources that are available and certain amount of steps that you recommend that they do while they're also going through their medical procedures. What has been your personal experience with these couples before we go into that?
So I try to help them with the stress as much as possible, and proactively I let them know about it, that it is going to be a stressful journey, to be prepared, to have resources, to have people that will support them, and not surround themselves by people who may not be supportive at the time. With that, I ask them to educate themselves more on what their insurance covers and what it does not cover, instead of waiting to find out. If they can change their insurance, something that provides better coverage for these sorts of things, then I encourage them to do so.
Would you say that quite often insurance could be a reason that somebody doesn't get the right form of treatment or the right form of knowledge?
Coverage for these things varies state to state, and that's unfortunate because you hope that it would be consistent, but it isn't. So there are other states that offer more coverage than some.
But you definitely recommend them to go through the full treatment if that is what's needed.
Yes.
For sure.
Yeah.
What are some of the other resources that you really recommend some of these patients to go through? I know mental health is a huge part of this problem as well. What are your takes on that?
So, like I said, stress is a big factor, and I also educate them that stress can also be a barrier to getting pregnant. So it can be a barrier. How it works, we don't really know, but we know that more stressed out couples are less likely to conceive. So with that, I say, you should talk to someone, talk to a therapist. There's no shame in it. Unfortunately, within the South Asian population,
Yeah.
depression, anxiety are still stigma.
Yeah.
And people don't want to talk to a therapist. So having the Indian background and being a physician, I tell them there's no shame to it, that this is something that's part of their health, that they're not imagining it, and it could be a barrier to having a child. So I try to take away that shame and encourage them to seek help.
And you also had mentioned earlier before our interview acupuncture. That's also something that you recommend. Why acupuncture?
A lot of reproductive endocrinologists who specialize in this sort of thing, where they are working on people's fertility and in trying to help them get pregnant, they work with acupuncturists that can help reduce stress. And although yes, it is considered alternative medicine, there are channels within our body that can be tapped into, that can increase fertility, that can decrease stress. And so these are important ways to help ourselves as well.
Wow, that's quite interesting. Science is definitely very interesting as long as you get it right. Wouldn't you say that?
I do. And with that, I always tell patients, even the ones with the South Asian background, keep an open mind. Don't close yourself off to alternative treatments.
Dr. Sama, I would love to ask you this question right now. When you are discussing these topics with the greater South Asian population or the greater community, what would you like for the community to sort of understand in order to help these couple? Perhaps I'm, sort of targeting the fact that maybe they don't get enough support from their peers or their families, and that could be a very, important aspect of getting successful in this. What is your take on that? If you were to give a message out to South Asian parents that are watching us right now, what would you say?
I would say that, you may not realize it, but it's a very stressful process. And often if one part of the couple or the other person is getting blamed, that it only makes things worse, not just emotionally, but trying to get pregnant in the first place.
And an advice I would love for you to give to young South Asian women. I think the topic of reproduction with careers and goals, with this whole push in feminism on really, fulfilling your true potential. How do you think young women, even women like me, should sort of manage that balance?
I try to build that relationship right away. I ask open, sometimes bold questions after building that relationship. And there are times when I talk about, okay, you're in school or you're just starting out on a great career. What are your plans on having a family in the near future? Sometimes the answer is, I don't want to have a family.
Yeah.
Definite. Okay. Other times I'm not sure, and other times I would love to, but I haven't met that right person yet. So for those cases, I'm like, have you thought about freezing your eggs, preserving your eggs, so that they can be used in the future? Yeah. And it's sometimes a difficult topic to talk about.
Yes, for sure.
But I have a lot of young South Asian women who come to talk to me about it themselves, and I encourage them to do it.
Doctor, I have to ask you this. We are coming towards a close of the show. Freezing your eggs is definitely something that you are talking about in terms of infertility, and it's straight access to, maybe sort of preserving that aspect for yourself. I would love for you to just give us a little bit more insight into your own personal comments on freezing eggs and also that entire process. What has been, success rates of your patients that you have seen so far on this?
So freezing eggs is a good option. However, it's not the answer to infertility itself, because as we get older, and especially South Asian women in general, there are multiple factors that are involved in not being able to get pregnant. So advanced maternal age, structural issues like fibroids and endometriosis are often seen in women who are older. So if possible, then it's better to obviously get pregnant at an earlier age. That's not always viable for everyone, but I always tell people, think about it. Don't just put it on the back burner.
Definitely. One last question for you, doctor. For everyone that's watching the show right now, I'm sure they must have a few questions, and one of their first questions should be, who should they approach right now? If there is a woman who's watching you and is realizing that perhaps there could be certain issues, or perhaps that she hasn't gone to a doctor in a few years, what do you have to say to them? And what are the health professionals that we should all be looking forward to in order to solve this issue?
Sure. As women, we should all have an internist that we have a strong relationship with, and we should also have a gynecologist that we have a strong relationship with. A good internist can refer you to multiple specialists that you may need, but to start off with one doctor who can guide you in many different ways is key.
Is key. Well, thank you so much for being with us here, Doctor. Any last message on the topic and on women's health?
I hope that this program will help many, that it will help bring more awareness, that it will help people realize that they're not on their own, and that there are all sorts of help that they can get to help themselves.
Thank you again, Dr. Soma.
Thank you.
Well, this was a wrap of our first episode for Desis in Health with Dr. Soma Mandal. Remember, some amazing insights she gave to us on women's health on the topic of infertility. Send us your questions for Dr. Soma on info@itvgo.com, and Dr. Soma would love to answer that, wouldn't you, Doctor?
Of course.
Well, thank you again for joining us.
Thank you, Aditi.
Tune in again to Desis in Health with Dr. Soma Mandal. I'm Aditi Lama signing off.